Well, ESMO G1 2023 is a great event, and our many presentations were around the question how to best select the ovarian cancer patients who could benefit from PARP inhibitor. Well, for that, we went deeper into the clinical and biological point of view within the PAOLA-1 first-line trial, which randomized a bit more than 800 patients to receive either Bevacizumab plus placebo or Bevacizumab plus Olaparib during 2 years. And those patients treated with Olaparib had a significant PFS and OS benefit when the tumor presented a deficit of DNA homologous recombination called HRD positive, as seen with BRCA mutation, but not only. And in this oral presentation, Antonio Gonzalez from JCO addressed the question whether some patients could be cured with the addition of Olaparib. Well, if we take the absence of relapse at 5 years as a surrogate of cure, which might be true for most of the patients with high-grade ovarian cancer, well, we have observed indeed that half of the patients with a BRCA mutation treated with Olaparib did not relapse at 5 years versus twice less in the placebo arm, 25%. And this is also observed in the patients without BRCA mutation, but with a positive HRD test, 41% still not relapsing in the Olaparib arm versus only 15% in the placebo arm at 5 years. And there is no benefit in the HRD negative group. In the HRD group, Dominica also showed that the best results were obtained in the patients who had a complete surgical resection at upfront surgery, whose overall survival at 5 years is 88% when treated with Olaparib plus Bev, which is just astonishing in the field of ovarian cancer. In front of these spectacular results from PARP inhibitor in first-line ovarian cancer, well, the question is how to detect HRD. And the reference test is the HRD My Choice CDX from Myriad. But following a European initiative, a certain number of academic or industry labs were able at least to match the Myriad test, and now are available. And 2 of the 10 new tests from the PAOLA sample, tested in the PAOLA sample, are presented during this Congress, both of them using shallow whole genome sequencing, one from the Institute Curie and the other from the Industry Sec1, presented by Dr. Boideau from Dijon. So these are fantastic advances in the field of ovarian cancer.